Modern chemotherapy can be brutally effective and brutally imperfect. For decades, oncology has relied on powerful drugs capable of killing rapidly dividing cells. Some patients experience remission while others gain precious years, but one terrifying problem continues haunting cancer medicine. Resistance. Tumors adapt, surviving cells evolve, cancer learns, and eventually, treatment that once worked may stop working entirely. This is why researchers increasingly search for combination strategies, not necessarily replacing chemotherapy, but strengthening it, sensitizing tumors, disrupting resistance pathways, attacking cancer from multiple biological angles simultaneously. And in recent years, one unlikely candidate has entered that conversation. A cheap anti-parasitic drug called Mebendazole, originally developed to kill intestinal worms, now investigated for something far more controversial: its potential ability to enhance standard cancer therapies. Toda, we explore the science, the mechanisms, the laboratory evidence, the skepticism, the economic controversy, and the enormous question now emerging inside oncology research communities worldwide. Could mebendazole synergize with chemotherapy? Or is this another case of scientific excitement racing ahead of clinical reality? Chemotherapy operates through controlled destruction. Many agents target rapidly dividing cells. Some damage DNA. Others disrupt microtubules, while some interfere with replication enzymes. The goal is simple: destroy cancer faster than the body collapses from toxicity. And sometimes it works remarkably well, but cancer is not static, it evolves. Under treatment pressure, tumors behave almost like biological ecosystems. Sensitive cells die first, then resistant cells survive. Over time, those resistant populations dominate. This process resembles natural selection, except that it unfolds inside the human body. Tumors develop defense mechanisms, drug efflux pumps, DNA repair enhancement, metabolic adaptation, microenvironmental shielding, apoptosis resistance, and alternative survival pathways. The result? Chemotherapy that once shrank tumors may eventually lose effectiveness. And this is precisely why modern oncology increasingly explores combination strategies, because attacking cancer from one direction may no longer be enough. Researchers now search for compounds capable of weakening tumor defenses, sensitizing malignant cells, or disrupting multiple pathways simultaneously. This is where mebendazole entered the conversation. For decades, mebendazole was considered ordinary, a low-cost anti-helminthic medication used worldwide against parasitic worm infections. Its primary mechanism seemed straightforward: disrupt microtubules inside parasites, prevent nutrient absorption, kill the organism. Simple. But scientists later recognized something fascinating. Cancer cells also depend heavily on microtubules, especially during mitosis, cell division. This matters enormously because some of the most powerful chemotherapy drugs in modern oncology already target microtubules directly. Paclitaxel, vincristine, vinblastine, docetaxel do this. These are major anti-cancer agents. So researchers began asking a provocative question: could mebendazole exert anti-tumor effects too? Early laboratory studies suggested yes. Cancer cell proliferation slowed, mitotic arrest occurred, microtubule organization collapsed, apoptotic signaling increased, and then another possibility emerged. What if mebendazole could work alongside existing chemotherapy? Not as a replacement, but as a synergistic enhancer. That idea triggered growing scientific interest. In oncology, synergy is one of the most valuable concepts in medicine. It means two treatments together achieve greater effects than expected individually. Not merely additive, amplified. This principle already defines many cancer protocols. Combination chemotherapy exists because tumors are adaptive, attack one pathway, and cancer may survive through another. But attack multiple vulnerabilities simultaneously, and survival becomes far more difficult. Researchers investigating mebendazole became particularly interested in several potential synergistic mechanisms: microtubule destabilization, cell cycle disruption, apoptosis enhancement, anti-angiogenic effects, metabolic stress, and possible interference with resistance pathways. Some studies suggested mebendazole could sensitize tumor cells to radiation and chemotherapy-induced death. That possibility changed everything because enhancing existing therapies may be easier than inventing entirely new ones. Microtubules are essential to cellular survival, especially during division. They function like structural highways inside cells, transporting materials, maintaining shape, and separating chromosomes during mitosis. If this system is disrupted, the cell may die. This is why microtubule targeting agents are central to chemotherapy. But tumors can develop resistance to them, and resistance remains one of oncology's greatest obstacles. Some preclinical studies suggest mebendazole may bind tubulin differently than certain conventional chemotherapy agents. That detail matters enormously because tumors resistant to one microtubule drug might remain vulnerable to another mechanism of disruption. Researchers began wondering, could mebendazole complement taxanes? Could it enhance mitotic catastrophe? Could it push stressed cancer cells beyond recovery? In laboratory models, some evidence suggested increased apoptotic activity when combined approaches were used. This fueled growing interest in combination protocols. Many chemotherapy-resistant tumors survive because they evade apoptosis, programmed cell death. Healthy cells self-destruct when severely damaged. Cancer cells disable these pathways, and this creates a terrifying biological advantage. Some laboratory evidence suggests mebendazole may reactivate apoptotic signaling in certain cancer models. Researchers observed caspase activation, cytochrome C release, mitotic arrest, DNA fragmentation, and mitochondrial disruption. If these effects occur alongside chemotherapy-induced stress, tumor vulnerability could theoretically increase. This process is called chemosensitization, making cancer cells more sensitive to standard treatment. And in modern oncology, sensitization strategies are extraordinarily important because improving existing therapies may dramatically impact survival outcomes without requiring entirely new drug platforms. The mebendazole story became even more intriguing in neuro-oncology, especially glioblastoma research. Glioblastoma remains one of the deadliest cancers known to medicine, partly because of the blood-brain barrier. Many chemotherapy agents struggle to penetrate brain tissue effectively, but some preclinical studies suggested mebendazole could cross the blood-brain barrier under certain conditions. That created enormous interest because if the drug also enhanced chemotherapy or radiation effects, it might hold relevance for brain tumor strategies. Researchers explored combinations with temozolomide, radiation therapy, and other standard approaches. Some glioma models demonstrated increased anti-tumor activity in combination settings. However, translating laboratory synergy into human survival improvements remains extremely difficult, and this distinction is critical. Visual direction, laboratory mice, tumors shrinking, then transition to real human oncology wards. Complexity increases dramatically. Cancer research is filled with compounds that performed beautifully in mice and failed in humans. This phenomenon is so common that some scientists call it the central tragedy of oncology drug development. Why? Because human cancer is vastly more complex. Tumor heterogeneity, immune interactions, metabolism, drug absorption, microenvironment dynamics, and genetic diversity all differ dramatically from controlled laboratory systems. A combination therapy may appear synergistic in petri dishes and yet fail clinically or produce unacceptable toxicity or never achieve therapeutic concentrations. This is why mainstream oncology remains cautious about mebendazole. The laboratory evidence is intriguing, but definitive large-scale clinical validation remains limited, and that nuance matters enormously. Another reason mebendazole became controversial involves economics. The drug is generic, cheap, and off-patent. This creates difficult financial incentives. Modern oncology trials cost enormous amounts of money, and companies prefer compounds with strong commercial potential. Repurposed generic drugs often lack that advantage. As a result, some researchers argue promising compounds may receive insufficient investigation. Critics counter that promising preclinical findings are extremely common and most ultimately fail. Both perspectives contain truth, but the economics of cancer research undeniably shape what gets studied aggressively, and this dynamic has profoundly influenced the mebendazole conversation. As research papers spread online, public fascination exploded. Cancer forums began discussing mebendazole intensely, especially among patients facing advanced disease. Some online communities framed it as a suppressed breakthrough, while others warned against dangerous oversimplification. Scientists urged caution because laboratory synergy does not equal clinical proof. Yet the interest persisted. Why? Because the underlying science was not imaginary, real studies existed. Real anti-tumor mechanisms were being investigated. Real apoptosis and sensitization findings had been reported. These created a powerful psychological dynamic. Hope, curiosity, skepticism, and controversy all colliding simultaneously. One reason researchers remain interested in mebendazole is because its effects may extend beyond a single mechanism. Cancer survives through redundancy. If one pathway fails, another compensates. This is why multi-target approaches increasingly attract attention. Some studies suggest mebendazole may influence microtubules, angiogenesis, apoptosis, cell cycle regulation, metabolic stress pathways, signal transduction systems, and potentially immune interactions. These broad biological footprints make the drug scientifically interesting, especially in resistant tumors, because attacking cancer on multiple fronts simultaneously may reduce adaptive escape mechanisms, at least theoretically. Few areas of medicine require greater communication discipline than oncology, especially when discussing experimental or repurposed therapies. Patients facing aggressive cancers are vulnerable, and hope becomes emotionally powerful. This creates ethical responsibilities. Researchers must remain open-minded enough to investigate unconventional findings, yet rigorous enough not to exaggerate preliminary evidence. The danger emerges when nuanced science becomes viral certainty. A laboratory synergy finding transforms into internet mythology, but responsible oncology requires precision. At present, mebendazole is not an established chemotherapy enhancer in standard clinical practice. The evidence remains exploratory, and patients deserve clarity about that reality. The future of oncology may belong increasingly to combination strategies, not single miracle drugs but layered systems including chemotherapy, immunotherapy, targeted therapy, radiation, metabolic intervention, drug repurposing, artificial intelligence-guided protocols, and precision genomics. Within this landscape, compounds like mebendazole may eventually serve as adjunctive tools, not replacing standard treatment, but potentially enhancing it. Researchers continue investigating optimal dosing, combination timing, tumor specificity, BBB penetration, resistance modulation, and apoptosis sensitization. The story remains unfinished, but the scientific interest is real. Behind every discussion about synergy are human beings, people hoping for more time, more birthdays, more conversations, more life. This emotional reality explains why compounds like mebendazole generate intense public attention, especially when standard therapies fail, because even the possibility of improved treatment sensitivity becomes psychologically enormous, and that is why responsible investigation matters. Not hype, not dismissal, but disciplined scientific exploration. So, could mebendazole enhance chemotherapy? Current preclinical evidence suggests the possibility is scientifically plausible. Researchers have documented mechanisms involving microtubule disruption, apoptosis induction, mitotic arrest, anti-angiogenic activity, and potential chemosensitization effects. Some laboratory and animal studies demonstrated enhanced anti-tumor activity when combined with standard therapies. Brain tumor research has been particularly intriguing because of potential blood-brain barrier penetration, but critical questions remain unanswered. Can these findings translate into meaningful human survival improvements? What doses are required? Which cancers respond best? What toxicities emerge? Can rigorous clinical trials validate the early promise? At this moment, the story remains incomplete. Mebendazole is neither proven revolution nor meaningless pseudoscience. It exists within a complicated scientific middle ground, one where legitimate biological findings intersect with enormous public fascination. And somewhere today, inside oncology laboratories across the world, researchers continue investigating a profound possibility that an overlooked generic drug might someday help standard cancer therapies work better against one of humanity's deadliest diseases. Science advances carefully through evidence, skepticism, and curiosity, and sometimes through unexpected discoveries hiding in ordinary places. The story of mebendazole and chemotherapy synergy is still unfolding, but it reflects something larger happening inside modern medicine. A growing realization that old drugs may still contain unexplored biology, that overlooked compounds may hold hidden potential, and that humanity's fight against cancer increasingly depends on understanding how therapies work together, not just alone. This documentary is for educational purposes only and is not medical advice. Patients should consult qualified healthcare professionals regarding diagnosis and treatment decisions.